Governor Walz says that the number of ICU beds are a big part of his decision to issue a stay-at-home order.
Right now, the state has a total of 235 ICU beds. The governor says if we had not done any social distancing, we would have filled up those beds in about 6 weeks. By practicing social distancing and staying at home, we should be able to push that out to about 11 weeks. WCCO's Jeff Wagner explains why state leaders believe just a few extra weeks will make a big difference.
As Minnesota's healthcare system prepares for a rush of patients needing treatment for COVID-19, Governor Tim Walz says it's possible the state will look beyond hospitals for help.
Working with the Corps of Engineers, we will be able to transfer our arenas or our stadiums into hospitals.
He wouldn't say which arenas were on their radar, but Dr. John Hick with Hennepin Healthcare said the choices also include hotels or public buildings. However, these options are not the immediate focus.
So the first order of business right now is to understand what we can do within the hospital walls to take care of the surge that might be coming towards us.
For example, Bethesda Hospital has been converted to strictly treat COVID-19 patients. Hennepin Healthcare is prepared to add 38 ICU beds if necessary.
As hospitals like Hennepin Healthcare work to make those changes to house more COVID-19 patients, there's one in South Minneapolis that's already made some serious headway.
We thought it was going to take weeks.
But in just 10 days, Abbott Northwestern converted 63 patient rooms into suites with negative airflow, meaning when you open the room's door, air moves in, not out. It's critical considering the virus attaches to airborne particles.
We want to keep the airflow going in towards the patient care so it doesn't get out into the common corridors where our staff might be walking and other folks might be out in that area.
Reallocating staff and making sure they have enough personal protective equipment are the next priorities. But officials say the best way to ensure hospitals don't get overwhelmed is for people to continue social distancing and stay at home. Jeff Wagner, WCCO 4 News.
Officials say more ICU beds have become available recently thanks to people who have canceled elective surgeries. Dr. Hick added that Minnesota has more than 1,000 ventilators, with half of them in the Twin Cities.